I just echo what has been said before. It's a privilege and honor to be here to talk a little bit about the depth and the breadth of the kind of papers that we get in circulation from the basic translational standpoint. We are all cardiologists in this room. I'm particularly interested in basic translational paper, and the aim of today, as has been done before, is to give you sort of 10,000 feet overview on what kind of papers in the field of basic translational study we receive and we strive to publish in circulation, and as exactly work for the epidemiology, heart failure, genetics, other fields of cardiovascular medicine. Also for the basic translational study, we strive to apply the same level of rigor, impact, and validity that across the whole spectrum of the paper. And like I said, today I will provide some example, very few example of this kind of paper. So what we are trying to do and what we are actually doing in circulation from the basic translational standpoint is, of course, to increase rigor, reproducibility of the basic translational paper. We do believe that a fundamental and accurate assessment of cardiovascular structure and function in preclinical model of heart failure or in general cardiovascular disease is critical to underline the pathophysiological mechanism of this condition. And indeed, there is no improvement of care without a deep understanding of the underlying pathogenetic mechanism of cardiovascular disease. And this must occur through preclinical modeling, animal-free alternatives, but the understanding of the mechanism that indeed participate in the pathogenesis of cardiovascular disease is critical to provide novel therapies and to ultimately improve the standard of care of patients. So, in this sense, circulation, we strive to get the best of the basic science being out there, and we always move from usually the paper that we get have an important clinical question, and then dissect out the mechanism of this condition. I will provide here an example that we recently published from a group of investigators from Stanford that moved indeed from the clinical question on and went through with delving in the mechanism that support their conclusion. So, as many of you know, immune checkpoint inhibitors are life-saving therapies for many types of cancer now. However, they mostly they can come with onwards complications, cardiac complications such as myocarditis. So this group investigator had done what has never been done before, and so to characterize the immunometabolic, the immune profile of circulating CD45 positive cells. So give us the really atlas of the immune cellular composition in patient with ICI myocarditis. So they have a different group of patients that respond or non-respond with myocarditis after treatment with immune checkpoint inhibitors. And they use a number of omics, including single nuclei, single cell RNA sequencing, to dissect out the atlas to provide in-depth transcriptome of the cellular component and immunophenotyping of the circulating cell. Of course, this end up with identification of several specific types or lymphocytes associated with this condition, and importantly, one particular subtype was associated with the clinical outcome. So the presence of a specific clone in the blood of patient with myocarditis after immune checkpoint inhibitors was associated with different type of outcomes. So to testify the clinical relevance of identification of specific immune cell type in patient with ICI-induced myocarditis. But of course, this stays a level of association which is critical for clinical research. But like I said, the understanding of the mechanism is important to provide in-depth novel clinical knowledge as well. So using the information that they obtain in patient, these authors went back to the lab, used a validated model of induced ICI myocarditis, and proved that in experimental model of disease, the same clone identified in the patient was able to elicit ICI myocarditis in mice, and they went down to dissect the mechanism by which the presence of this pathogenetic clone is associated with this in critical cardiovascular condition. So again, a clinical question with the clinical sample and identification of something that occurs in patient, and then bring it back to the bench in the lab to dissect out the mechanism underlying this syndrome. Another example of paper that, as Joe mentioned before, we acknowledge the Lo Scalzo Award for the best basic translational science in that year circulation. I would like to point it out that this award is not based on the number of citations, is not based on the number of metrics that are commonly used in terms of addressing the importance of a paper, but is largely adjudicated to papers that have an impact, or that potentially will have an impact in cardiovascular disease. And this is what we believe that the case of this paper from Peking University, in which they developed for the first time a vaccine for atherosclerosis, but not only for atherosclerosis, but also that is able to impact on nointimal hyperplasia, targeting a specific molecule of the extracellular matrix called ADMTS. So I will walk you through to this paper and the recipient of the Scalzo Award this year. And this investigator started again with the screening of specifically subclone of B cell that is associated with the reduction in nointimal formation in preclinical model of injury. So as you can see here, they were able to identify specific peptides from ADMTS that are able to reduce the inhibition of which is able to reduce nointimal hyperplasia. So they developed a vaccine, they immunize animals, they developed a vaccine for this, and they tested in mouse model of carotid injury. As you can see here, this vaccine, again, this epitope of ADMTS is greatly able to reduce neovascular injury, neurovascular formation after injury. They move forward using two different models, preclinical model of atherosclerosis in ApoE knockout mice, LDL receptor knockout mice, and sure enough, the use of this vaccine against ADMTS4 was able to reduce significantly atherosclerotic formation. So all of this has been done in small rodents preclinical model. So, and then on the characteristic, we try to have it for basic circulation paper is the use of large animal model. So in this case, this investigator used these peptides, this vaccine, to a pig model of coronary restenosis. You can see the stent that they place in the coronary here, and in the presence of the vaccine, the reduction of neointimal formation after stent implantation. So preclinical modeling, including both rodent models and large animal models. So I will stop here, and again, I will reiterate what is a privilege to work with this amazing group of investigators across a multiple area of expertise within circulation, and I'm happy to take any question in the discussion part. Thank you.